Hello, this is Dr. Rhonda Johnson. Today is Thursday, June 16th, 2022. And today I'm doing a two-part update on the COVID-19 vaccines for children under 5. Part 1 is an overview, and in Part 2 I'm going to try to ask some common questions and answers. So you heard about it on the news, I'm sure, on June 14th and 15th. The FDA Independent Advisory Group recommended that the FDA grant emergency use authorization for the Pfizer and Moderna vaccines for children as young as 6 months of age. So that advisory group recommended the vaccines. Then it goes to the FDA director for approval. Then it goes to the vaccine advisory group of the CDC, and then the CDC director will decide on her recommendation. But folks, I think it's almost certain that the FDA and the CDC are going to authorize both vaccines. So parents, you'll have two choices. How will you know which vaccine to choose? As always, I recommend that you talk with your child's doctor or your child's healthcare provider about the COVID-19 vaccines, just as you would with any other vaccine. But I'm going to just briefly go over the Moderna vaccine and the Pfizer vaccine. So, and then in Part 2, I'll do the questions and answers that I think are least important to start with. So the Moderna vaccine, again, is 6 months through 17 years of age, because the current Moderna vaccine is only approved for 18 and up. So Moderna tested its 2-dose vaccine in more than 6,000 children. Now, there was different effectiveness at preventing symptomatic disease during the Omicron wave. This effectiveness varied by age group. I think that's some very complicated stuff, so I'm not going into it. But here's the basics. The Moderna shots are 2 doses spaced 4 weeks apart. Different doses for different ages. Moderna's dose for 6 months to 5 years is 1/4 of the adult dose. For children 6 to 11, the dose is 1/2 of the adult dose. And for teens 12 to 17, they'll get the same dose as adults. Now, the Moderna messenger RNA dose, even for children, is higher than the Pfizer vaccine dose, just like for the adult vaccine. Some experts say that gives you stronger protection. I won't discuss that. But I do want you to remember that it takes about 2 weeks after the second dose for the immune system to be fully protected in terms of your antibody response. So that's the basics on the Moderna. Now the basics on the Pfizer COVID vaccine, which is approved for 6 months through 4 years of age. Because remember, the vaccine has already been approved for 5 to 11 and 12 and up. So for the Pfizer vaccine, children ages 6 months through 4 years, they get a 3-shot series. The first 2 doses are spaced 3 weeks apart, and then the third dose 2 months later after the second. Now, the Pfizer dosage for 6 months to 4 years of age is 1/10 the adult dose. One big difference between these two is that it'll take longer to build up your immunity with the Pfizer 3-shot series as opposed to the 2-shot series with Moderna. It'll take about 95 days if you figure, 2 shots separated by 21 days, then another 60 days, then 2 weeks after that to have full immunity. So that's a high-level overview. Please tune in to my second video today on some common questions and answers. As always, please discuss this with your doctor. Thank you.